everybody. Welcome to Adena, Living Well with Adena here on Facebook. So we appreciate your attendance this afternoon. My name's Kirk Tucker. I'm one of the internal medicine physicians. I'm standing in today for Dr. Kataka, who's away on other duties. What we're going to talk about today is about high blood pressure and maintaining healthy blood pressure. It's very important, but it's even more so now in the era of COVID-19. There's added stress and complexity to everyday life due to the pandemic, and this has shown an increase in patients presenting to our offices with high blood pressure. Having high blood pressure can raise your risk of experiencing some severe complications from coronavirus, so it's one of the listed high-risk areas. Uncontrolled high blood pressure or hypertension is a leading cause of heart attacks and strokes in the United States. Nearly half of adults in the United States have high blood pressure or hypertension, which is defined as a consistent blood pressure reading of over 130 on the top or 80 on the bottom, 130 over 80. Most people that have this don't even know they have it because, generally speaking, until a catastrophe happens, it's symptom-free. Having high blood pressure also increases your risk of heart disease and stroke because high blood pressure often has no symptoms. Checking your blood pressure is the only way to know whether or not it's running too high. The good news is that in most cases you can manage your blood pressure to lower your risk for serious health problems. Today we're going to discuss ways to prevent and manage your blood pressure, as well as demonstrate how blood pressure is measured and what the numbers actually mean. So joining us today is Heather Nickel. She is a nurse practitioner from Adena Family Medicine at the Woodland Center, and Carrie Johnson, nurse practitioner at Adena Health Center in Waverly. Welcome, ladies. Thank you for joining us. Heather, please tell us about yourself and what you do there at Woodlands.
All right. Well, hello. Like you said, my name is Heather Nickel, and I am a nurse practitioner, and I am at Adena Family in Woodlands. Most people know that as the old Glatfelter Clinic. It is by the Old Mead, or Pixel as it is now known. We are a full-service family health center, so we have a lab, we have a pharmacy that just opened a couple of weeks ago, so we're able to take care of a lot of needs. We do acute visits. I see everybody from little ones to all the way up. I do a little bit of, I have a background in rheumatology as well, so I'm very versed in arthritis, some of the autoimmune diseases. I will do hypertension, diabetes, pretty much a little bit of everything. And we have two other wonderful providers that are also there that are seeing new patients as well. So if anybody needs a new provider in the area, come and see me.
Wonderful. And we'll tell you how to get in touch with them here at the end. Carrie, tell us about yourself and what you do here at Adena.
So I am a nurse practitioner at the Waverly office. I work on a care team with Dr. Justin Smith, who does internal medicine, and Melissa Flores, who's another nurse practitioner. Our office is a little bit different because we do work in care teams. Our team is internal medicine based, so we see patients 15 and up. We do have some children that we see on our team. Usually it's a child of somebody that we're already seeing. And then the other team in the office is Dr. Howard, Amy McNaughton, and Holly Dunham, and they're the family medicine side. Both teams are taking patients right now, and as you had said, we are a full service center as well. We just don't have the pharmacy, but we have urgent care where we do COVID testing, rapid COVID testing, lab, physical therapy, cardiac rehab, imaging, we have cardiology, women's health.
Service facilities.
Mm-hmm. Yeah.
Wonderful. Well, thank you, and again, welcome. I appreciate you taking time out of your busy days to come talk to folks today. I also want to highlight very briefly, you might notice that we're not wearing masks today. I've made that decision for the benefit of the hearing impaired that might want to watch this today. I've learned myself that sometimes when I can't read lips that understanding speech can get quite difficult. So we went ahead and are doing that for the hearing impaired's benefit. All right, Heather, let's first talk about blood pressure. Tell us more about high blood pressure in the circulatory system.
Well, kind of trying to keep this simple. We all know our bodies need oxygen to survive, and the way that oxygen gets circulated is our heart pumping the blood around, and blood pressure is the way that that happens, and you have to have adequate blood pressure, so it shouldn't be too high and it shouldn't be too low. And just the way that that works pretty much is our heart pumps, and the beating of that is that top number, and when it rests, that's your bottom number, and so you want those to, it's got to be like a good pump, like for your pool and circulating the water around in your pool for the water pump. So it just has to work correctly.
All right, and can you talk more about specifically high blood pressure and what it means to have it?
So if you have high blood pressure, as Dr. Tucker said, you want that number to be below 130/80. If it's too high, then you're putting too much pressure. I mean, just as it says, your vessels are essentially like little water hoses in there. So if you have too much pressure, it's going to be hard on the pump, which is your heart, and can eventually make those kinds of things give out, leak, have problems.
Excellent. Carrie, what are some of the causes of high blood pressure? Can you highlight some of those for us?
So hypertension is a chronic disease, so it's something that develops over time. One of the main causes of hypertension are lifestyle choices, so things like diet, so salt intake, alcohol intake, weight, and then there's family history that has genetics, and then there's other chronic conditions that are influenced by hypertension, but then can also influence hypertension itself, like chronic kidney disease, diabetes, pregnancy, things like that.
Excellent. And Carrie, tell us, what are the risks of having high blood pressure?
So because it's a silent killer, most people don't know that they have it, so that is one of the main risks, is you don't know it until you have it. So it can cause a lot of damage to your vessels in the endothelial walls and the smooth muscle, causing damage to your heart and your cerebral vascular system, causing stroke, heart attack, and it can even lead to dementia later in life as well.
Yep, I've been reading a lot about links between that and potentially dementia later in life. Heather, can you talk us through about how having high blood pressure leads to heart disease?
Of course, Carrie kind of touched on that a little bit, and as we said, you know, your heart does pump the blood, and it has to do that effectively, and if that is too high and there's too much pressure, then that can lead to things like heart attack, heart failure, because the blood's not being pumped effectively, or the pressure is a little too high and it's trying to push it too hard. So the longer those things go on, like I said, heart attack can block the blood flow. We can have different things. You can get clots or just not enough blood flow, which leads to tissue death because there's no oxygen that the muscles need to live.
Okay. So that talks about high blood pressure in the heart. Carrie, tell us a little bit about high blood pressure, how it can lead to stroke or other brain problems.
So stroke, there's two different kinds that we have to talk about. So 87% of strokes are ischemic, meaning that there is oxygen restriction to the area, and then about the other 13% are hemorrhagic, meaning that there's blood leakage somewhere. The ischemic strokes, because there's 87% cause, a lot of those are caused by hypertension and prolonged hypertension, especially the basilar strokes that cause a lot of the deep injury. And then the hemorrhagic strokes are the ones that you think of as far as there's the incidental traumas where people fall, but then there's the cerebral aneurysms that people hear about. And those are the ones where you always hear people, well, their blood pressure is too high, they're going to stroke out. And often it's not necessarily because their blood pressure is high one time. It's a thing that happens over time, unless they have these other risk factors.
And think about it kind of like a garden hose. That's why we have pressure regulators in our houses. Eventually, if that's too high for too long, that hose ruptures. That's the 30% of strokes, which are hemorrhagic. So, Carrie, we mentioned that high blood pressure is known as a silent killer due to there not being usually obvious symptoms until something catastrophic happens. So what do you think is the best way to diagnose high blood pressure?
The best way to diagnose high blood pressure is to get your blood pressure taken. This can be done in your home. This can be done at a local pharmacy. You can have it done at your healthcare provider's office. If you have questions about how to do that, you can ask your healthcare provider, and we're going to demonstrate that now.
All right, I think now would be a good time to show the audience how blood pressure test works. I'm sure many of you have experienced it, but I'm going to ask Heather to walk us through a demonstration on myself, and hopefully I don't get any surprises this morning. So take it away, Heather.
All right. Now, if you go to the doctor's office, you're probably going to see a little bit different of a machine than this. A lot of times we do them manually with a stethoscope, but for a lot of people that are going to check them at home, this is probably what you're going to see. They're usually very simple. It's a cuff and a machine, and it usually has one or two buttons. So the most important thing is to know how to put it on correctly. You're very loud. All right.
I like to tell patients that the closer that you get to your heart, the more accurate the measurement is. So I've seen monitors on the market that go around fingers or wrists. I'm not as big of a fan of those. Yes, very comfortable.
Okay. So there's usually a little line that says artery, or a little place it here. You have arteries right here, and this is where you want that to be to get a really accurate a reading. Just turn it a little bit more. And you always want your arm to be nice and rested. Try not to tense it up. If at all possible, you want it to be around your heart level. So kind of hard to do that right now, but resting on his legs, it's pretty good. You don't want to just leave it dangling, because that can change your readings. And these at-home cuffs sometimes do get a little tight, and sometimes people think that's uncomfortable, but try not to tense up, because that will change your reading, or it'll make it harder for it to read, and it'll stay pumped up for longer. So it kind of prolongs the little bit of discomfort.
And also, for purposes of the demo, a little bit of my shirt's under the cuff. Please try to make sure there's no clothing or other barriers between the cuff and your bare skin. So the pump is filling up, and if you've had this done, it feels like somebody just squeezing your arm really hard. I can feel my arm pulse a little bit or throb, but
And it doesn't last very long. It'll be over very quickly.
all right, and that's what it took. And of course, I didn't talk during the measurement. You should remain still, try not to move a lot, and then also not speak. The machine is trying to measure very sensitive pulsations that are occurring in your arteries in your arm. So, am I going to live?
You're going to live.
But it looks like I need to take my pills.
Yes.
So I told her I forgot last night.
Yep.
So, bad doctor. Oh, wait a minute, I'm not supposed to go anywhere yet.
Not yet.
Sorry about that, folks. It looks a little chaotic. There might be some, Heather, who are tuning in who have their heart numbers told to them by a physician, but may not know exactly what they mean. Could you please explain what the top number and the bottom number mean in respect to hypertension?
Awesome. Yes, so like we said, a good target number is 130 or over 80 or below. You don't want those numbers to be above that. And like I said, the top number is what happens when the heart's pumping, and the bottom number is at rest. So you need to have a nice little, you don't want them to be too close together, you don't want them to be too far apart. Some people that have hypertension may have a different target range depending on what your provider recommends for your specific situation, but in general, these are the numbers that we want to strive for. And we don't always just take, just because Dr. Tucker's number was this one time, we wouldn't necessarily say he has hypertension. We say he would have a high reading, but we need those numbers to stay high consistently to actually say that you have hypertension.
Some would say I'm under too much stress, which is true. All right, Carrie, if someone's been diagnosed with high blood pressure, what are some ways to manage or lower it and also prevent it?
So the number one way to lower your blood pressure is by making lifestyle changes. They recommend getting 150 minutes of activity a week. That would be 30 minutes, 5 days a week. A lot of people can't tolerate 30 minutes a day, so they even say that you could do 10 minutes 3 times a day if that's something that you tolerate better. How you divvy up that 150 minutes a week is whatever you're able to tolerate the best. Quitting smoking if you are a smoker, decreasing the salt in your diet if you drink alcohol, slowly stopping that alcohol intake would help with that. Managing your stress, taking medications if you are prescribed medications and taking them appropriately and consistently.
Very good, I would agree. And Carrie, keeping blood pressure under control can mean sometimes even adding things to your life. We talk about reducing things like salt and alcohol. But things like exercise that you mentioned can help lower it. Are there also things that people with high blood pressure should avoid?
So if you have high blood pressure and you're ill, we recommend that you avoid things like Sudafed, so decongestants, so anything that says cold and flu. There are medications that you can take, like coruscating HBP. It still has medication in it that may raise your blood pressure up a little bit, but not necessarily as high as the other cold and flu medications. As far as sodium, ideally they say less than 1,500 milligrams of sodium. In America, it's one of the hardest things to do. Anytime you eat out or eat a frozen meal, 1,500 milligrams is pretty much in one meal. So you would have to be very diligent to do that. But I have had people come off of their blood pressure medication by staying under 2,000 milligrams a day. They've been on 3 or 4 medications, they change their diet, they decrease their sodium intake, and now they're no longer on. And they had no weight loss, they just decreased the sodium. So
yep. That's amazing that you can get that kind of result just by paying attention to the diet.
Yeah. Weight loss, they say there's a 1-to-2 ratio, so for every 2 pounds they expect a millimeter difference, so 1 point difference in your blood pressure, your systolic blood pressure. Decreasing your alcohol, so they recommend alcohol intake, not recommend, suggest no more than 2 drinks a day for a man, 1 drink a day for a woman, and a drink meaning a 12-ounce can of beer, not a pitcher.
Sure.
So.
Gotcha. I think a lot of times I did some reading on high sodium foods, and many times I'll mention the low sodium diet to patients, and they'll say, I don't even keep a salt shaker on the table. And I say, that's excellent. And I'll say, but there are many things where it hides, and it's routine content. So all pickled foods like olives and pickles, processed lunch meats notorious for high sodium, especially things like bologna and ham. Certainly bacon, we know about that when we eat it, but a lot of regular soup doesn't taste very well to us Western dieters unless it's got a lot of salt in it. Spaghetti sauce and even pizza crust can be kind of surprising. So one of the things I'll tell them is to start getting used to reading labels. And if you can just look at the side with 1 or 2 servings added up, you can see how quickly you can get to that 1,500 milligrams. So,
if you shop in the U shape of the grocery store, it's the easiest way to avoid the sodium, is what they say.
Yeah, that's around the healthy side. So
the outside,
produce and all that kind of stuff. I like that.
Stay away from the middle.
Excellent.
Yeah.
Yeah, if it's canned or in a sealed package, watch out, right?
Yeah.
All right, Heather, to sort of begin closing things up, what are some steps that our viewers can take to keep their blood pressure under control?
So, like we've said, know your numbers. That's why we always recommend at least a yearly well visit with your provider. Many people say, I don't go to the doctor. I haven't been to the doctor in 10 years. I don't have anything wrong with me. We don't have anything wrong with you because you haven't gone to a provider and been checked out. And that's when people find things, I never knew I had this. So the best way to stay healthy is to stay on top of things. Like I said, your yearly well visit. Usually those are preventative, and they're covered pretty well by most insurance plans. So go in and have a checkup. Let somebody check your blood pressure. Keep an eye on it at home. You can check it on the machines that you see in Walmart and such, but sometimes they're not always right. So, you know, if it does look a little high, you should have it checked out by a professional. But don't always get too upset about those numbers. Work with your healthcare provider, as I said. Make lifestyle changes, like Carrie talked about, diet, exercise. You don't have to cut out everything, but make better choices. Change 1 or 2 things and you can change your blood pressure readings very easily. So the sodium, the staying active, you know, even if you just pick 1 or 2 of those things at a time. I always tell my patients, we don't have to change everything at once because that's a recipe for failure. Pick 1 or 2 things that is the most important and to you, and the most important that you think you can succeed at, because once you succeed at one thing, then you're gonna feel better about it and you're gonna be empowered to continue to do that, and it'll be easier to keep that up.
And I think, you know, being one who prescribes medication as well, and then guilty of having missed it last night, probably the reason my number looks a little funky, doing everything you can to try to make sure that you take your medication as prescribed and on a regular basis. So I keep it right by in my bathroom sink where I do my teeth brushing at night, and that is a sort of a click reminder for me that I need to take that before I go to bed. So here we're heading into the question and answer segment, which is always a lot of fun. I'm just going to remind the audience, you guys can send in your questions over, I believe it's the Facebook Live platform. And we'll start with these. Maria's handed them to me. The first question says that my blood pressure stays in a good range with daily medications. How often should I check my blood pressure?
My first question is, what is a good range?
Yeah.
you. So a lot of patients will say, my blood pressure is fine. And I say, well, what's fine? And they say, well, it's like 150. So my first question is, well, what's a good range? If you've been taking your blood pressure consistently on a daily basis and it's actually in a normal range, then I usually tell people they can back off to once or twice a week.
Yep.
Yep.
And it's a progressive thing. So good range is, again, below the threshold for defining out of control, so 130 over 80 or less. We usually do not recommend that people look at just a single number and pass judgment. So as you're doing your blood pressure checks daily or however you're advised, if you know how to average those up, so let's say you've got 5 of them, add them all, the top numbers all together, and then divide by 5, whatever number there are in there. That gives you the average, and that's kind of what you're acting upon, the average blood pressure assessment, let's say week by week. Unless it's extremely elevated and remains elevated at every measurement, that does require the attention of your healthcare provider. So I would agree with Carrie that as you're maybe starting new medications or coming off of medications due to lifestyle changes, weight loss, exercise, you're eating less salt, checking it once or twice a day is probably going to be warranted. As you get to your new steady state and the medicine's doing well, you can then start to spread those things out to once or twice a week. And I would recommend picking different times of day. So sometimes check it in the morning. The next time you might check it before bed. The next time you might check it midday. But always while you're seated, comfortable, calm, after about 10 minutes so that you get an accurate measurement. The next question says that both my parents have high blood pressure. I'm in my 30s and my blood pressure is okay so far. Am I destined to get high blood pressure later in life because of my family history? That's a great question.
Not necessarily. Family genetics do take a part in anything as we age and we get older. But just because they have high blood pressure does not mean you are destined to have high blood pressure. But it is a risk factor, so that is something that is even more important for you to make sure you stay up on it and get those checks yearly and those periodic checks just to make sure that things don't change. Because as we get older in our 30s and our 40s, that is when things kind of start to rear their ugly head and things happen. But if maybe you have different lifestyles than your parents, so it might not happen. So not necessarily.
Yep. And I think it's a great time also with your concerns that you implement some of those lifestyle things early. So if your blood pressure is great now, let's keep it that way.
Exactly.
So stay active. Try to exercise the 30 minutes a day. Try to maintain as close as you can to an ideal body weight. Start getting yourself used to maybe a lower sodium diet now. It can make a lot of difference for your future. So diabetes is the same way, by the way. All right, any other questions coming in?
It's much easier to prevent something than to wait till it gets out of hand and then try to stuff it back in the box. So
this is a great question, and probably one that you two are better equipped to answer than me, is can children have high blood pressure? And what would their signs of high blood pressure be in a child or adolescent?
Absolutely. I've had some children with high blood pressure. I think probably some of the bigger risk factors is we're not necessarily as healthy and as active as we used to be. When we were children, there were more things that we did. They were a little healthier, a little more active. And kind of overwhelmingly, we're getting away from that. Children are more sedentary. Sometimes their diets aren't as good. Weight is an issue. Stress, there's a lot of stress with children, bullying and those kinds of things, and depression and anxiety. And that can all kind of trigger those things. So yet again, another reason why to have your yearly well child checks done too, to keep those things under control and monitored well.
Absolutely. And look at those things that might be contributing risk factors. So again, we talked about diet activity, body habitus. If you do have a child that carries some extra weight and they have not been assessed by a healthcare provider, it's a really good idea to let them get in and have their blood pressure checked, maybe other potentially labs that might need done. Certainly, as we mentioned earlier, it can be a silent chronic disease that there might not be a symptom. But if the child's complaining of problems with frequent headaches, I know with adults sometimes even nosebleeds, if you can imagine, can be presenting signs or symptoms that actually something's wrong with the blood pressure. But when in doubt, get it checked is the best way to focus on that. It's also a great time of life for parents to start getting their child used to a less American diet, less sodium. So the things like the snack foods, the chips, the pretzels, the Doritos, the Cheetos, a lot of pre-prepared foods, canned foods, all come with so much sodium in them. And we kind of set this salt threshold for each of ourselves. As a matter of fact, sometimes when foreigners come and eat American cuisine, it's not very tasty to them because the salt content is so high. So it's a great time to start those healthy lifestyle choices in your child. I know my wife focuses very heavily on a lot of vegetables and fruit and celery and apples and bananas around the house for them to snack on. And good luck trying to sneak in a bag of Doritos. I mean, she finds those things and then they're just gone. So she does a great job with that. Let's see. Who's got another question?
It's also
here?
a good thing to do that with your children and start to like meal prep or meal plan, or take them to the grocery store with you so that they can see, instead of just saying those are bad for you, you can't eat them. Well, why? And do it together so that they have some ownership and some control over the decisions and the changes in their life, and they can help do that, and then they kind of will learn those things as to why it's healthy for me and why I should do it, and then it gives them more purpose to continue those when they get older too.
Excellent points.
And I've seen kids a lot more now with the days of social media, Instagram, Snapchat, TikTok, drinking a lot more caffeine too.
Mm-hmm.
And allowable
Yes.
by parents taking them to Starbucks on purpose and taking them to these, and giving them high caffeine beverages. And well, it's fine, they just have one.
Yeah.
But all of that can contribute to that.
Yeah,
High blood pressure
caffeine is
down
a
the-
powerful stimulant, and it can raise your blood pressure, can raise your heart rate, any number of problems. Unfortunately, it can also, if you get used to using it a lot and then you don't have it, make you more sleepy than you otherwise would be. So I would caution parents very much about letting their kids have high content beverages that have high caffeine content at a young age. It's just too soon. This is a great question, very apropos to what the world we're living in. Are we all seeing more people coming in with blood pressure symptoms that are a result of COVID lifestyle and stress?
You want to take that one?
You said COVID lifestyle?
Just the general stress
Yes,
of living in
I
this
would
environment,
say-
and then the election and then
I
the
feel like
pandemic.
more people have uncontrolled chronic health conditions at this point. Less people are leaving their home, less people are taking their medications adequately. People have more financial stress, so a lot of people are picking and choosing which medications they are even taking. Less people are coming into the office, less people are taking their blood pressures and their sugars at home because they either don't have the resources or they don't want to leave their house. They're gaining weight, we call the quarantine 15 or more sometimes. So I've seen less controlled chronic conditions lately than I have in the past.
The shirt's just really puffy. I've
Oh, mine too.
Yeah,
of
so.
course.
But yeah, I would say that's a great question, and I am, as a practicing physician, I'm seeing a lot of people coming in with anxiety. Anxiety's out of control, and again, it contributes to any number of things, including high blood pressure, blood sugar control. So yes, excellent question, and yes, we are seeing that. So I think I hear Maria scribbling one out there. Can you explain the difference between an American diet and a European diet? So since I'm the one that sort of commented, I think you brought it up first. When you look at sort of the classic American diet, at least as the reading suggests and I see it, we tend to be high in what I like to call convenience foods that are high in immediate reward. So the example I'm going to make is your average fast food drive-through like a Burger King. Don't get me wrong, I love the original chicken sandwich. Love it, love it. The problem with that is you've got this piece of what otherwise might have been sort of healthy to start with, white meat chicken. Deep fried, breaded, put on a bun with high fat content mayonnaise, and then salted to beat the band, right? Comes with a side of fries, which are concentrated starch, but then covered in salt. And then depending upon what you like to drink, the average sugar beverage, sweet tea or regular Coke. So you get this hit in one of your meals, which should probably account for maybe 600, 700 calories of your day, that if you add up the calorie content and the sodium content, you've already broken your daily limit, really, within the original chicken sandwich and some fries. So it's this high reward type of a diet. When you look at the diets they tend to quote as much more healthy, such as how the Japanese choose to eat, Mediterranean diets, they're all referenced from that part of the world where they're much higher in things that you basically can recognize as having been picked off a plant. So a lot higher in vegetables, certainly. Fruit. They don't marinate or salt their vegetables. They're seasoned with appropriate, sometimes very delicious spices that have low sodium content. And they're cooked in a way that is much more healthier than deep frying or stir frying in like fat or vegetable oil. So those are just kind of some of the basics, but specifically I love the commentary on sort of our salt set point here in America, and that's not an absolute given. Meaning if you travel around the world and kind of feel out or measure how much salt added to a meal people actually find is appetizing, that in the West it's much higher. So we tend to just be kind of salt junkies over here. And it's not something, that's the neat part about this, it's not something you're stuck with for life. You can slowly train your way backward from sort of being a salt-loving person in your diet to sort of a new diet that still is very flavorful and tasty, but if you ever got a piece of the food the way you used to eat it, it wouldn't be appealing anymore. And so that's, I think, one of the neatest things about diet and sodium intake. Uh-oh, this one looks like a hard one. I'm going to make one of the NPs answer this. All right. This is a sort of a beginning of our closing comments. We would certainly recommend for anybody that's interested to see their primary care doctor for a checkup or a well visit. Part of your well visit is an assessment of your vitals. You'll be weighed. We'll do your blood pressure. If you need a primary care physician in or around the Adena service area, please call local area code 740-779-FIND, F-I-N-D. Again, 779-FIND. And that hotline will help pair you up with a primary care physician, hopefully close to your home. I'd like to thank everybody for joining us today, and I'm also looking forward to doing this again, or watching it at least, with Dr. Kataka hosting Living Well with Adena on November 5th, where we will be discussing cancer prevention, screening, and diagnosis. So something very poignant to probably a lot of the people in the audience. We've talked about the 77-FIND number, and just as a final, as we continue to struggle through the pandemic, and hopefully we're starting to see some numbers come down. This health system's been very, very busy with COVID patients on the unit. Please, everybody, we're sending out messaging to all of our Adena staff. Please, 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 in public, wear your masks. I know it's a real pain. It makes my ears hurt. I just want to throw the thing off sometimes. But please, until we get the vaccine or this thing starts to go away on its own, please wear your mask when you're out in public. And with that being said, I'd like to thank our attendees today, and thank you guys for watching. So have a nice afternoon.